I also express my gratitude to WHO regional office and the CRO countries for helping each other during the pandemic situation. This pandemic COVID situation, it is the first time within 100 years such a pandemic took place in the world, and everybody was caught unaware. People were not ready. People didn't know where this coronavirus came from, how it affects, what are the treatments for the corona patients, how it will be controlled. Nobody knew in the whole world. Even in Bangladesh, we didn't know what to do when we were faced with this coronavirus patients. We got the first patient in March, and at the third week of March, we had the first death from coronavirus. Immediately, with the advice of our Prime Minister Sheikh Hasina, we sat down and made a national committee, and then we made district committee, then sub-district committee, and up to the village level, we had the committee to monitor this corona and the corona patients. So in order to face corona, we first also prepared our hospital. We made about 20,000 COVID beds for COVID patients. Then we arranged dedicated COVID hospitals also. Then testing facility, we had only one main laboratory. Then this laboratory were set up in all the hospitals of the country, including the private sector, and total about over 800 these testing facilities were made so that testing could be done easily. We had to do a lot of testings for the common people, free of cost. In the land port, seaport, airport, we did this screening and testing. For the migrant workers, for the foreigners, we had to do the testing, and for the all start of the society with we did the testing. And then we had to arrange medicine which are required for corona patients, especially the remdesivir, which we got from USA and we produced locally. That was an expensive medicine, but we gave free to the patients. Then oxygen was an important issue in the treatment of corona patients. So we didn't have all the central oxygen line that was required. So during the lockdown, we had to install about 120 central oxygen line in hospitals along with liquid oxygen plant so that oxygen were available to the patients. Along with that, we provided telemedicine services to the people in the remote areas. We had to care for them. We had to advise them and told them not to come to the hospital because sometimes there were not enough beds. So we gave the advices through telemedicine, medicine, and through giving medicines to their homes, respective houses. Medicines were also sent. Then there was a dearth of medical personalities, that is the service providers. So during the corona period, with the direction of our Prime Minister, we employed about 12,000 doctors immediately and about 15,000 nurses to face this corona situation. Along with this, we had to also treat the non-corona patients. because which are more in number, and they were being neglected. So we had to treat those non-corona patients. We had to ensure deliveries for the mothers during the corona situation, and also the Rohingyas, which are in about a million of Rohingyas. We had to also provide services to them. So all put together, we had to work quite hard, and we had to maintain relationship with WHO Geneva and WHO regional office in Delhi. They always advised us how to tackle the situation, how to make the treatment guide, treatment facilities. So we did take the advices and try to address our situation according to their guidance also. And along with that, we also mobilize a multi-sectoral approach. There was, only health couldn't tackle that. We had to take the help of our home ministry, our local government, because mayors were involved, chairmen were required. Then we had to have big uh, uh, vaccination campaign. First, we had to procure vaccines. Bangladesh is one of the first countries who could procure vaccine and give vaccine to its people in the region. We got vaccines from India, from China, from COVAX facility, totaling about 310 million vaccines we procured and gave to our people. Now, most of our eligible people are vaccinated, which are about over 90%. And even the childrens are now being vaccinated. The school, colleges were closed. We also vaccinated them, and now they are open. So these are the important steps that we did during the corona. This, along with that, also we kept on the regular services, that is uh, vaccination of our people. We could say extended vaccination program, EPI. Then the vitamin A capsule campaign. Even during corona, we had to do that, and also ensured PPE, then mask, and then a lot of equipment like high flow nasal cannula. These were also provided to the hospital, so that the uh, the care, the proper care could be taken for the corona patients. So along with that, we also uh, this post-corona situation, that is how to move forward. We are, corona has taught us a lot of lessons. That is to give more importance to the health sector, to strengthen the health system. That we are doing. We are equipping the hospital with modern equipments, which previously we didn't had, like central oxygen line. This we did. Then training of our this medical service providers like doctor, nurses, we did, and employment of more medical personnels, that is doctor, nurses, technicians. We are doing, and we need to do more in that sector. We don't meet the WHO requirement as yet, but we plan to meet those requirements. Then, along with that, we had to keep focus on the universal health coverage, because that is an important issue. We have to do the attain the universal health coverage along with SGDs. So we are working on that line. So we presently we are also giving importance to the NCDs, non-communicable disease, which are increasing. And in Bangladesh, it is about 67% of the people who are dying from NCDs, non-communicable disease, like cancer, like kidney failure, diabetes, heart ailments, stroke. So for that, we are making new hospitals. in the tertiary level, and NCT corners, because we are also giving a lot of importance to preventive side in the coming days. That is, for that we are having corners, NCT corners in all our sub-district level, even in the primary healthcare like community clinics, which we have got 14,000, family welfare center about 4,000. There also we have introduced counseling arrangements, so that they can counsel on different diseases and different non-communicable disease as well as communicable diseases. That we are doing. Then to ensure this uh, universal health coverage, government is providing now more or less free health services to the people, at least in the government hospitals and in the primary healthcare also. Free services, free medicines, and we are already doing a piloting a program which will ensure free medical treatment. The government will be providing the entire cost, and that is through an insurance system, an insurance coverage that is being done in Bangladesh. And also the upgrading of the hospitals, we are also trying to do that. Along with that, communicable disease like TB is a big burden for Bangladesh. So we have installed about over 400 gene expert machines all over the country. Testings are being done regularly, and now identification has increased. Treatment is about effective treatment is about 97%, and in that we are improving, but we need to improve much more. Another issue we are focusing is the antimicrobial resistance. It is a big problem for the entire world and also for Bangladesh. So we have made a policy on that, that there should not be any over-the-counter sale of antibiotics. No improper use of antibiotics. Excessive use of antibiotics is discouraged. And there is a policy that whoever does in the pharmacy, if somebody violates, then they will be punished. Along with this, we are also focusing on the child and mother health, adolescent health, and we want that our institutional delivery should be increased more. And because now about 40% delivery still takes place in the home, where due to that situation, death of child and mothers increases. So we are trying to achieve the SDGs in that aspect also, to reduce the mother's mortality rate to 70%, which is to 70. Now it is 163. To achieve SDG, we have to reduce it to 70. And the infant mortality, child mortality to 12, which is now about around 30. So these are the important issues that we are planning and going ahead with. I hope that with the support of WHO, we should be able to fulfill all the requirements and achieve SDGs. Thank you.